Why care about the health of your mouth? Your smile is the first thing people look at when they look at you. People judge you by how your mouth looks. I would know. That judgment has been my life's journey and why I'm here today, bringing awareness to the health of your mouth. My name is Sherry Words. I'm a mom, a registered dental hygienist, an oral facial myologist, an oral health coach, a burst ambassador, author, and speaker. As a child, I had an iron deficiency and high fevers, and I was given an antibiotic called tetracycline. Back then, they didn't know that that antibiotic would cause staining in your teeth below the gum line. My two front teeth came in yellow, dark gray, and had 2 orange spots on them. I was teased and bullied on the bus. I dreaded that ride home. Kids would laugh, point, ask if I owned a toothbrush and knew how to use it, and no one wanted to sit with the girl with the dirty teeth. It made me very self-conscious, and it affected my self-esteem. People always thought I was unhappy, and when I smiled, I didn't show my teeth, I kept my lips shut. I didn't like being made fun of. It didn't feel good, so I didn't smile until I got braces. It wasn't until I got braces off and had veneers done that I realized just how important smiling can affect your mood, my mood, and how people treat you. I was proud of my smile for the first time in my life. When I smiled, I showed my teeth. Strangers smiled back and spoke to me. People treated me differently because I felt different about myself. I was more confident and engaged in conversation more. It was like smiling was my newfound superpower, whereas before it was my kryptonite. Back then, I didn't know that smiling released feel-good chemicals in your brain. Bonus, those endorphins also served as pain relief that makes you feel better. I wish I knew that back then. What I've learned since is when you smile, people see you as courteous, competent, and likable. Even a forced smile when you're depressed can change your inner feelings and give you a boost. Smiling is contagious, translated in any language, and can actually add years to your life. Your mouth is, and has been, one of the most important parts of your body. We use it to speak, sing, eat, drink, breathe, smile, and even show emotion. Digestion of our food starts in our mouth. Chewing releases saliva from our salivary glands, which releases an enzyme which helps break down our food and aid in digestion. Our mouth is a window into what's happening into our body. Sometimes signs and symptoms of illnesses present, and we don't pay attention to what our mouth is telling us. It could be a crystal ball, like looking into our future. But do we listen? It's not just a bunch of hocus pocus. Now more than ever, our habits and our immune system have been emphasized. The link between our oral health and our overall health has always been there. Now, it's just more talked about. Most people shortcut toothbrushing. They don't brush correctly or long enough and leave 50% of the plaque and bacteria behind, especially if you're using a manual toothbrush. I'm not saying you have to use an electric toothbrush. I'm just saying you have to work harder and pay more attention when you use a manual toothbrush. You only get 300 rotations per minute, as compared to an electric toothbrush, which is 33,000 rotations per minute. It's recommended you brush 2 minutes twice a day. Yet 30% of our population brush about 45 seconds once a day. In the next episode, we'll talk about the proper way to brush, how to hold your brush, and I'll show you the differences between manual and electric toothbrushes. I see patients every day who leave plaque behind on the surface of the teeth, and they don't even know it. 85% of Americans have some form of dental disease. 1 out of 2 of us have gingivitis. That means either you or the person sitting next to you. I've had it several times myself. You can reverse it and prevent it with your toothbrush. We have 700 different types of bacteria in our mouth. You can be tested to see which of those bacteria you have in your mouth. Knowing what bacteria is present makes it easier for dental professionals to know how to treat it. Some bacteria are worse than others, and you may need an antibiotic, a deep cleaning, or both as treatment. Bacterial is familial, meaning if you share a drink, a straw, a fork, or a kiss, you've passed that bacteria to your loved one. I hope you know the health of your mouth, or your family's mouth, or your friend's mouth, because when you're sharing food, you're sharing more than food. I've been a dental professional for over 30 years. I've seen trends come and go. Watch as we tell patients that if they're getting cavities, it must be something they're doing, or not doing, or they're not brushing enough, or they're not flossing enough. It must be something you're doing at home, right? Have you ever felt that way when you go to the dentist? Like it's your fault? Don't get me wrong, I'm a huge advocate of going to the dentist and brushing and mastering brushing. Before you add any other tools to your routine, make sure you get brushing down. And it's not necessarily something you're doing or not doing. Consistent brushing has been proven to reduce bacteria in your mouth that spread to other parts of your body. Maintaining a healthy mouth is beneficial not only to your mouth, but your entire body. The standards we grew up with have not changed much. We still recommend brushing, flossing, using a fluoride toothpaste, and visiting your dentist twice a year. We hear it all the time. Heck, I even say it. Most people don't follow that. Why? Because your teeth don't hurt until the nerve is affected. Sometimes teeth can heal themselves to a certain extent if it's small. We leave teeth in our mouth, even though they're hurt and injured, and it affects our body, creating a chronic disease. Teeth are the only part of our skeleton that we leave even though they're injured. We wouldn't leave an open wound to fester. But our mouth is the only part of our skeleton we clean, and the only part of our skeleton we don't take care of right away when it's broken or injured. And we wonder why dentistry is expensive. But ask yourself, is it the dentistry that's expensive or the neglect and the fact that you put it off? After all, it doesn't hurt, why fix it? Knowing the health of your mouth and having a consistent daily routine and visiting your dentist regularly allows them to document your journey, the condition of your mouth, with x-rays, gum measurements, and pictures. And things can be detected early. Signs of disease, not only in your mouth, but systemic diseases like diabetes, heart disease, impetus, Alzheimer's, respiratory disease, just to name a few. All of these can be detected if we can compare from one visit to another what's going on. Having the health of your mouth consistently documented can help you identify when something is off. According to the World Health Organization, 422 million Americans have diabetes. Many of those are walking around undiagnosed. They don't know they have it. Like gum disease, 7.2 million to be exact. You don't know you have it. The cost to manage diabetes is $400 to $500 a day. Disease in your mouth worsens the condition of other diseases in your body like diabetes. Diabetes is the major cause of kidney failure, lower limb amputation, stroke, and in some cases it's a precursor to other diseases like heart disease, which is the leading cause of death in the United States. One person dies every 37 seconds in the United States from cardiovascular disease. That's about 647,000 Americans that die from heart disease every year. 1 in every 4 deaths. And the health of your mouth is linked to it. You wouldn't know that by the way we care for our mouth. We don't seem to be too concerned about the fact that people are dying of heart disease or cancer, as we are about other illnesses. Why? Good question. Is it because our healthcare system just treats what's presented to them? Or do we do this to ourselves in the lifestyle choices that we make? Why is one disease more noteworthy than another? COVID-19 has brought awareness to the fact that we're more susceptible if our immune system is weakened. We're still going to have the same number of deaths unless we change our habits. Simple habits like hand washing, brushing our teeth, washing our face. From this hygienist viewpoint, it all starts in your mouth. If you've seen a dentist and you have cavities every time you go, or you're having bleeding gums, and nothing you do is working and you're frustrated, it might be something that's happening in your body. You need to be a bit of a detective and find the cause. There is one, I promise. Even though Americans currently have dental benefits, 23% of Americans have no dental coverage, which translates to 74 million people in the US that don't have dental insurance. And according to the Center of Disease Control and Prevention, more than 1/3 of adults have not seen a dentist in the past year. According to the American Dental Association, 40% of those adults who didn't visit the dentist do so because of cost. When they do go to the dentist and they have insurance, they want the free cleaning that your insurance pays for. That free cleaning is for a healthy mouth. And I see maybe 1 or 2 people a day that have a healthy mouth. And those are the people that are going to the dentist. So what about the people that aren't going to the dentist? What does their mouth look like? I'm not here to judge. I'm just bringing awareness to the fact that there's a problem. And there's also a trust issue of people that go to the dentist, especially when they're told they need a deep cleaning. The insurance company is who sets the guidelines, x-rays, gum disease, pictures, to tell us how to treat you. FYI, insurance benefits haven't changed since I was that little kid needing dental help. yet premiums and costs to treat you have gone up. Insurance companies are actually paying dentists less. Having been married to a dentist, the profit margins are not that great. And now with COVID, they're going to get even smaller. Employers offer benefits to their employees to help keep them healthy. If you neglected your dental health for a long time, that's when the cost adds up. Simple checkups cost $85 to $200. Fillings run about $200 to $500. And crowns and root canals are over $1,000. For Americans that don't have dental insurance, this can cause them to put off going to the dentist. And even if you have dental insurance, it only allows a maximum of $1,000, $2,000 at most per year. And people want us to treat them based on what their insurance company will cover, not necessarily what they themselves need. Knowing what you're looking for when you go to the dentist will help with the satisfaction factor when you leave. Studies show people that don't have dental insurance are more likely to have teeth pulled, resulting in expensive procedures needing when you want replacement. Or worse, you need dentures and you don't like it and now you need implants. They're also less likely to visit the dentist regularly and less likely to treat gum disease due to the cost, which then adds to more diseases that are not related. So 67% of Americans that don't get their gum disease treated are more likely to have heart disease, 50% osteoporosis, 29% diabetes. The list goes on. Healthier employees are happier employees. They're more productive and they provide better services to clients and customers. We're all unique in what we need, and we're at varying degrees of health. And our ability to receive affordable quality care, going to the dentist and knowing the health of your mouth is going to be more important going forward. If for whatever reasons you can't see a dentist or afford a dentist, you can hire a health coach, an oral health coach, a coach for your mouth. What do? We teach you how to look in your mouth, how to tweak your home care with the tools that you have, or give you suggestions of products and tools you can use to get the best results for your time and money, for your family, and reduce cavities and disease in your mouth. If we don't have all the answers, we'll help find someone that will get you to your next step. Your oral health coach might also recommend an oral myofacial therapist. You're asking, now what the heck is that? An oral health coach is a personal trainer for what to look for and how to use the tools at home. A myofunctional therapist is a personal trainer for the muscles below your eyes and above your shoulders. Very specific. They teach you how to strengthen the oral facial muscles and help you breathe easier, swallow, and help get rid of habits like thumb sucking, finger sucking, nail biting, tongue thrusting. This is a picture of my daughter. It took us a while to break this habit. I was not going to have a child that sucked her thumb. She didn't suck her thumb. I sucked my thumb till I was 12. And I wasn't going to have a daughter that did that. But she sucked her fingers, which is why I became an oral myofacial therapist, so I could help not only her, but other parents. A myofunctional therapist is a perfect natural solution to help with frequent congestion, difficulty breathing, sleep apnea, tongue thrusting, snoring, chronic ear infections, and more. Sometimes all it takes is working with your tongue position or breaking your habit. Just one session I've had. But then there are more difficult cases that require a speech pathologist, an ENT, or an orthodontist to intervene. Early intervention is key and hopefully happens before the age of 10. Traditionally, myofunctional therapy takes place on a one-on-one setting, and they teach you personal exercises over a period of a month or 2 or 12 months. And they give you those exercises that you can do to reach the goals that you outline. They meet weekly or bi-weekly, and you continue to build on what you've learned until you reach the desired goal. Modern therapy has evolved to include technology to be virtual. With this technology advancing, teletherapy is now an option that many therapists are incorporating into their practices to treat patients in the comfort of their own home. Some patients even have a hybrid where it's part online, part in person to help reduce therapy costs. And therapy can cost anywhere from $100 to $3,000. One thing is evident to me as a dental professional: you are in control of your health. You get to be aware that there are options. You can take responsibility and choose the right option that's right for you or your family. You need to be your own healthcare advocate. It all starts at home with you, your attitudes, beliefs, your options, your education. Educate yourself. You need to be the CEO of your health. You get to choose. The majority of people only brush once a day, less than 2 minutes, and they don't go to the dentist regularly. If we change our habits, we can change our lives. In general, we don't give our mouth much thought, like breathing. We don't think about it until there's a problem. I feel if we know better, we can do better. And that's the point of the Healthy Mouth movement. Our healthcare system treats disease, and we spend over $3 trillion a year in healthcare. It averages out to over $5,000 per year per person. If we spent more time paying attention to our mouth every day with our habits and preventing things, we might be able to lower those costs and the money we spend on healthcare. Our oral cavity has been called the mirror of health into our body. For a long time, we can't separate our head from the rest of our body. And there are thousands of studies that show the diseases in our mouth are connected to diseases in our body. Pay close attention to what your mouth looks like and what your kid's mouth looks like. I've seen cavities and gum disease increase over years. I've watched family members die and spoken to doctors that didn't believe that what I was seeing in the mouth was connected to the health of their body. And I've seen others who have listened, and we've been able to save lives. The mouth is the first place we should be looking, screening, and treating. And if you can't get your mouth healthy with seeing a dentist, it's trying to tell you there's something wrong with your body. Again, you need to be your own healthcare advocate and look into it. If something doesn't feel right, get another opinion. Trust your spidey senses. You may need to change your mindset and how you look at your mouth and take care of your mouth, because it all starts in our mouth. I've seen patient after patient be diagnosed with disease years later, and they couldn't get control of their gums and bleeding. After being treated for an illness like diabetes or leukemia, miraculously their gums are better. I didn't do anything. They got the disease treated, and their gums were magically better. Integrative medicine is our future. We talk about gut health and our gut being our second brain. Our mouth is an early warning system and a window into our body. Bacteria on our teeth, tongue, and mouth, in our saliva, can hold answers to our overall health if we listen and we don't ignore it. Imagine if a contractor walked in your house to fix a leak. There's a dark spot in your ceiling. They painted over it with white paint and handed you a bill. Would you look at them like, what? Are you gonna look and see what the problem is? Leaky pipe? Do I need a new roof? Yet dental patients come into dentists and ask us to straighten and whiten their teeth. But no deep cleaning, don't look at anything else, I don't want any cavities fixed. Or worse yet, they're doing DIY, getting Smile Direct and moving their teeth without even knowing the health of their mouth and do they have disease. I don't recommend that. What's the cause of your dental disease? Do you have dental disease? Are you checking? Do you know? What questions do you need to ask? We need to ask better questions and be more vigilant. What if the key to healing chronic disease in our bodies was found in our mouth? What if we took the time to listen? What if we think about what we put in our mouth? That's a whole nother episode. But what we put in our bodies and in our mouth is just as important as how we care for our bodies and our mouth. Foods that we eat have changed over time. Dr. Kevin Boyd is a pediatric dentist in Chicago, and he calls it Darwinian Dentistry. He teaches how the agricultural revolution has changed the way we consume foods and the foods that we do consume. It's changed our posture, our DNA, our growth patterns, our jaws, our breathing, and our immune system. If your mouth is not healthy, I don't care how physically fit you are, you can have chronic disease and your body's not healthy. We are still seeing our mouth as separate from our body. We need to see our mouth as part of our body as a whole, an influential part of how our body heals. Everything is connected when it comes to our health. Our mindset, our mouth, our body. Dental health is crucial to overall health and the appearance of how we look throughout life. Children need to be shown by the adults in their life how to care for their teeth. It's just as important as eating or washing your hands or tying your shoes or potty training. Teaching our children good dental habits is by practicing good dental habits yourself, or better yet, as a family. Why is this important to your kids? Good health promotes a beautiful smile, good self-esteem, breathing. ADHD might be from breathing. Good oral health can help prevent cavities. Establishing good oral health can establish good lifelong habits. Proper dental care and early intervention can help prevent bad breath, plaque, gingivitis, gum disease, and many other systemic illnesses. Why do we go to a dentist? We just assume we're supposed to go and that's what we're told? Most people have the wrong perception about why they go to the dentist and what that means. Going to the dentist is important because your dentist can diagnose disease early, not only for your mouth, but your overall body in some cases. In case you didn't notice, we've been talking about the connection of our mouth to our body and our overall health and our systemic health. When you go to the dentist on a routine basis, it's easier to take care of issues and see them earlier before they become a problem and costlier in the future. Cavities and gum disease is something that's silent. You might not even know that you have it. There are many reasons we go to the dentist or don't go to the dentist. Lack of time, lack of insurance, cost, fear, culture, being ashamed. You had a bad experience when you were a child. These are all topics of why people say they don't go to the dentist. It's my goal to help you understand that your mouth is connected to your overall health, and it's so much easier to connect it sooner rather than later. I want to help you understand how to take control of your mouth, your dental care, and establish family-friendly routines that last for a lifetime. So you don't go to a dentist to prevent cavities. What if I can show you how to prevent cavities at home by establishing a good routine in this mini-series? What if the choices you make lead to a healthier life and a healthier body? There's so much information at our fingertips about health, diet, exercise, sugar, what to do, what not to do, that impacts our mouth and our body. I'm asking you to join the Healthy Mouth Movement. Share to change your life or somebody else's life. My name is Sherry Wirtz. I'm a single mom to a beautiful daughter, dental hygienist, oral health coach, oral myofunctional therapist, burst ambassador, author, speaker. If I could go back and whisper into my 9-year-old self's ear, I would say, embrace who you are, be you, embrace your flaws. Look into that mirror, look at your smile, smile at yourself, be thankful, because one day what you're experiencing right now is going to become your story, and you're going to share that story to change somebody else's life. That smile that you don't want to look at right now is going to create a movement and save lives, one smile at a time. Thank you for watching. If this was helpful, please like, subscribe, and share. For more information, go to www.dentalhygiene411.com. I also have a Facebook page and an Instagram. Smile. You're worth it. A healthy mouth is a healthy body and a healthy life.